Wonderful. Thank you, everyone, for joining us to the Canadian Alliance of Nurse Educators Using Simulation, our webinar series. Get us to work here. So today we're going to be talking about building capacity, simulations, faculty, practice, and academic. This is about the Canadian Certified Simulation Nurse Educator Program. And the presenters today are Marion Luchter-Flood, myself, Nicole Harder, and Suzanne Campbell. We would like to have a disclosure of the support for CANSIM, and this is done through Medicore Lab, eLearnza, and Spectrum NASCO. And finally, just some housekeeping. If we could have everyone mute their screens, and actually if you need to, you can stop your video. We do have the chat button that we will be monitoring throughout the webinar. If you have any questions, you can place them in there and we'll look at those. And then know that at the end, we've got 15 minutes that we will have a live question and answer. So if you would prefer to wait to put your text in there, that would be another option for you. So I'm going to stop share here and have Marion. Great. So we'll just get on the first page here.
Can you see it?
Yes. So your main screen title isn't on. So we'll go ahead. So again, as I said, this is a building capacity. So it's a discussion about the Canadian Certified Simulation Nurse Educator, the CCSNE program. We'll go to the next slide.
So I think this is where, hi everyone, sorry, I just feel like I jumped right in there. Just our opportunity to introduce ourselves to you. So just like I had said, my name is Nicole Harder, and I am from the University of Manitoba in Winnipeg, and I am one of the 4 educators who are part of the CASN program and part of a larger group who also were part of the setting the exam for the CCSNE program through CASN. So I don't know if the rest of my team wants to just quickly introduce themselves, that would be great.
Hi everyone, I'm Suzanne Campbell and I'm at the University of British Columbia as an associate professor there, and I've been very excited to be part of the team that has built and teaches part of the modules of this and to share with you today. Thanks for coming.
Hi, I'm Marion Luchter-Flood. I'm an associate professor at Queen's University, and I'm also co-president of CANSIM.
I'm Jane Tyerman. I'm an assistant professor at the University of Ottawa and co-president of the Canadian Alliance of Nurse Educators Using Simulation. And you can see from this slide, this was the last time we actually saw each other in person. We were probably going to have bigger smiles on our face when we can meet again.
Great, thanks everyone.
Pardon me?
Oh, I said thank you.
We would also like to acknowledge Dr. Cynthia Baker. She's the executive director of CASN, and we really need to acknowledge her visionary leadership and innovation to conceptualize the CCSNE in Canada was deeply needed, and so her leadership in organizing, developing, and implementing this program.
So I'll just give you all a little bit of some background of what we'll talk a little bit about the background of where this sort of came from, why we have, why the team has been involved in creating and delivering the courses through CASN. We'll talk a little bit about how the modules build on each other, what each module includes, and then just sort of there's a broader impact that we do believe is part of being in the CCSNE program, just because there's the academic part, but one thing that we have found is that the simulation community is very much into sharing, and just we'll talk a little bit about that as well. So we do have excuse me, folks, I'm still getting over pneumonia. We do have objectives. Every good simulationist has objectives. with their program. And so what we will talk about is, like I said before, the purpose of the CCSNE program. We'll outline the modules. They do build on each other. However, we have also developed them to be standalone, so that way folks can take them out of order without feeling like they're missing out. So we'll talk a little bit about what those modules look like. We'll talk about the academic, like I said, there's that aspect, but also the practical component of being an educator as well, which is very important. Strategies of how you can actually, we've done a little bit of an assessment in terms of what works for folks while they're working through the CCSNE program or through the modules of the Simulation Educator program. And then we'll talk a little bit about that, just ways that you can meet our learning outcomes. And like I said, some of the assessments that we've worked through. And then just really the ability to be for the collaboration and to be able to network, and sort of some of the things that we've heard through different attendees of the program, but also some of our own experiences. We think that those are very helpful as well. So why do we even have this? We were like, excuse me, like Jane had said, we're very fortunate that we've had leadership through CASN who has identified not only the need for this program, but also the importance of having something very specific to simulation. And in large part is because, as we all know, especially high fidelity simulation, and we're talking mostly in-person simulation that we had pre-pandemic, really has been an increase in use and across Canada. So there's that aspect, but then also there was very much a need to understand that simulation is, of course, we have simulators, which are the technology, but just really how to teach in simulation. There's a skill set around that. So as we say here, simulation is a pedagogy. So what does that look like? Most of us are all nurses, so we haven't necessarily been taught how to learn or how to teach in simulation. And that's one thing that we've really tried to lay some of that foundation, so that way people feel comfortable in teaching with simulation, regardless of what kind of technology they use. We also know that simulation is extremely effective in helping learners apply concepts that they've either learned through workshops, through their theory courses, even in terms of skills, how to put this all together. However, they need to be well designed. And so you don't just show up in the sim lab and expect everything to be brilliant. There needs to be, there's a process. There's right from before you even start to conceptualize what this looks like, all the way through to your final evaluations. They really need to be well designed. And that was, again, an important aspect that we've identified. We need education in this. And so, like I said before, we are nurses. I don't know about any of you, but I think my first teaching position, I was very much thrown into the deep end and really didn't know what I was doing. And we teach how we were taught. And that's what I did. And I think I had a few real epic failures there. And so it's really important to sort of learn from each other and find out how are we going to be able to take advantage of this teaching modality and teach the teaching strategy to really improve and enhance their learning experience that our students have. Now, historically, most of us have learned by going to workshops, reading papers, maybe going to conferences and just really hearing about it. But by doing so, you're just taking snippets here and there. You're not really putting the full picture together. Or if this is what I do, is I think of things that I might be interested in, and those are the only things I attend, as opposed to really getting a well-rounded and broad kind of experience. And so that's why with the workshops, or sorry, with the CASN program, we've really identified all aspects of simulation and are trying to make it a program that is really is very fulsome, is very robust. So that way you're not just getting the snippets here and there. You've got the opportunities to discuss with your peers, to do the readings, and to really start to apply some of the concepts that you learn through the CASN program. And as we said before, CASN recognized that there was a real need to have some kind of standardized program and certification, and that this was something that came from nurse educators right across Canada. And they took this on to be able to create this program, to offer the program, but then also to offer certification. And as we'll hear in a little bit, we've been fairly full in a lot of our courses. And so the demand is definitely there. And especially with the pandemic and now the increase in virtual simulation use, I don't see this changing anytime soon.
So as Nicole has mentioned, CASN has provided leadership in both nursing education and specifically regarding simulation. And in 2013, CASN published guidelines for simulation along with their guidelines for clinical placements. By 2017, CASN had organized a simulation task force, which outlined 6 core competencies and the related indicators for simulation nurse educators. So what are the skills that a nurse educator needs to have to be able to teach effectively using simulation? And it was these 6 competencies that formed the basis for the Canadian Simulation Nurse Educator Certification Program. And so we're going to talk about these 6 competencies and where they fit in within the 4-module program. So the overall purpose of the CCSNE program was to build capacity of nurse educators to use simulation and teach effectively with it. And it can be used for both pre-licensure undergraduate nursing education, as well as continuing education or professional development for practicing nurses. Secondarily, it was to help nurse educators to help the transition from graduate nurse to practitioner. It can be used, simulation can be used to evaluate internationally educated nurses. And so that's a high stakes assessment. And so really requires educators with a very specific knowledge of simulation to be able to use simulation for that purpose. The program can help educators that are providing continuing professional development for clinicians, and as well as those that are providing team training for quality improvement and patient safety. So as Nicole mentioned, the CCSNE program was developed by the 4 educators from across Canada, so myself and my 3 co-presenters. We were all considered experts in clinical simulation. We've been doing simulation since 2005, and also experts in nursing education. As I mentioned before, the modules were designed around the 6 competencies. So you can see that module 1 covers competencies 1 and 2. Module 2 covers competency 3. Module 3 covers competency 4, and module 4 covers 5 and 6. And so the course content is relevant to nurse educators in both academic and clinical settings. Some people think the focus is on academic. However, there's no reason why a clinical nurse educator couldn't take the course and use the knowledge from this course in the clinical setting. But overall, the program prepares participants to write the CCSNE certification exam, which is now offered twice a year.
So in module 1, the topic is theory and design. The first competency is draws on foundational theories and simulation pedagogy when teaching simulation. This includes describing foundational theories and frameworks that are commonly embedded in simulation pedagogy, articulates how a personal philosophy aligns with these theories and philosophies for using simulation to facilitate teaching and learning. It supports the learner to reflect on their own skills, knowledge, and performance as a simulation instructor, identifies the relationship between simulation types of learning outcomes and learning activities, selects appropriate simulation typologies and fidelities based on the desired learning outcomes, the nature of the learning sought, and the types of issues to be addressed, and finally identifies components of a safe learning environment for learners engaged in simulation-based practice experiences. The second competency, designs effective simulation, embeds learning theories and frameworks in simulation design, involves conducting a needs assessment for simulation-based learning activities or outcomes within their own program, aligns simulation activities with learning outcomes, related courses, and the curriculum as a whole. Utilizes a comprehensive and appropriate template for simulation scenarios. Identifies appropriate physical and human resources needed to create simulation for a range of simulation typologies. Describes the optimal environment for conducting simulation. Applies simulation principles and operational logistics in the use of simulation scenarios. Adapts the simulation scenario to the needs, skill level, and diversity of learners prior to the simulation scenario. Determines the length and frequency of simulation-based experiences in relation to the complexity, prevalence of the problem, and nature of the learning outcomes. And then finally determines the methods of learner evaluation prior to the simulation-based experience. So you can see we have, a wide depth and breadth for this theory and design. The content is divided into 6 separate weeks. So week 1, we talk about theories and frameworks, where we reflect on one's skills, knowledge, and performance. There's justification for self-evaluation ratings. In week 2, we talk about self-regulated learning, and this involves writing effective learning outcomes for simulation, development of learning outcome assessment rubrics. Week 3, we focus on the typologies and fidelities and begin the process of creating a storyboard for a simulation scenario. Week 4, we look at different scenario templates and begin filling that and developing a case flow. Week 5, we focus on the pre-simulation preparation and the pre-briefing associated with the sim that they're developing. And finally, week 6, the scenario delivery. So planning, staging, and implementation. And we also speak about virtual simulation. The main assignment within Module 1 is we'll have the learners create their own unique simulation scenario using a standardized and peer-reviewed template. And you can see each week of this course focuses on a different section of the template. So by the time they're finished the 6 weeks, they will have a ready-to-go scenario. Marion and I give feedback each week on the different assignments to help them build it. Feedback.
Hi, everyone. My turn to introduce you to Module 2, which Nicole and I just finished up. They took their final exam last night, and I'm excited looking at the participants to see that we have some past students in the room as well, or learners, I should say. So Module 2, the competency that we're looking at is number 3, and it's really how to facilitate effective learning with the use of simulation. Oftentimes people do take these modules chronologically, so they are coming to us in Module 2 having a scenario that they have developed, and this is a great opportunity for them to do some piloting with it and tweaking and getting some peer review. But we walk them through the basic areas. So first of all, the pre-briefing component, we provide them with opportunities and suggestions about what to create for that pre-brief learner's experience so that students and learners have sufficient time and information prior to the simulation itself. We look at some of the guidelines around the simulation experience to ensure that it's a safe learning environment. So a lot of discussion about psychological safety and how to handle and set things up for that. We incorporate some of those preparatory activities and pre-briefing into how that's thought about early on with the learning objectives, and then how you might best go about providing it. The large part of the module is looking at facilitation and what actually happens. So it's hard not to think about the scenario design and development and the learning objectives when you're doing that. But then how do you actually facilitate? So we get down into the nitty gritty about providing prompts and cues appropriately, feedback, scripted or not. We use a variety of methods. to provide those environmental and with other roles within the scenario. And we give them constructive and timely feedback. So how can they, as the educators, provide that for their learners in the situation? We look at models of ethical approaches to maintain that professional integrity in the simulation teaching and learning environment, and provide ideas about consistency and how to create an environment where these scenarios are consistent for all learners. Finally, we spend a lot of time on debriefing and look at simulation-based experiences. What's a conducive environment for debriefing? What are some of the different best practices and frameworks? And how can we best facilitate learning? The content similarly is 7 weeks of content. Week 8, so the modules last for 8 weeks, is the final exam. But we start off with the phases of simulation, looking at standards of best practice, and we do rely on the INACSL standards of best practice for much of this. Week 2, we get into that preparation and pre-brief, looking at levels of learners and psychological safeties. Week 3 is specifically about the prompts and cues and how we can do effective questioning. And week 4, we're doing more of the effective feedback and targeting our learners toward deliberate practice. In week 5, we talk about managing groups and looking at difficult conversations and getting people engaged and involved. And then week 6 and 7, we unpack the debriefing, first looking at the frameworks and providing opportunities for students to learn with that. We'll pass the baton to Nicole.
Thanks. So module 3 is the next one that's coming up. So if anybody's looking for something to do this spring/summer, I'm sure there's still registration room that's available. But this one is really on interprofessional collaboration. And so what we look at in this one is we look at some of the foundations of interprofessional collaboration. And so we really kind of try to discern the difference between interprofessionalism, interdisciplinary simulations, and really kind of look at how different professions, generally health professions, can get together and create these learning experiences for our learners. And you'll find that this is includes, like we said before, both students and practitioners. We look at how to design the simulation, how to facilitate and implement the simulation, and we also identify different kinds of debriefing strategies that you might think of, as well as any kinds of barriers and any kind of effective strategies for implementation. So we really try to lay the foundation for this simulation or for this module. Now, the actual content of the module, like I said, we spend quite a bit of time initially talking about the introduction of this. So we go through the CIHC, the Canadian Interprofessional Health Collaborative. We go into those roles, those competencies, and really try to, like I said before, lay that foundation. So that way, when we're building the actual simulation, you know what you're building it upon. You know that you have different areas that you want to focus on, different areas that you need to address when you're designing a simulation. So we do spend quite a bit of time on that. And then when we get into the rest of it, if you look at numbers 3, 4, 5, 6, really these are very similar to what we would do in module 2 in terms of how do you design the sim, how do you pre-brief, how do you prepare the prompts and cues. However, we make this in the interprofessional context. So what we do here is we really try to overlay the foundations that we have, overlay that onto all of these areas. So it does help for people if they've previously taken module 2, not necessary because we will revisit that, but this is where we really spend some time getting into the delivery of the simulation. And no interprofessional simulation discussion would be complete without discussing barriers and strategies. And I find this is a very useful discussion that we have because some people have been very successful at identifying and addressing them. And we spend a lot of time sharing our experiences. And so we spend, like I said, quite a bit of time trying to figure out different strategies for the learners, and end with an exam. Again, similar to every other module, we finish the last week with an exam that kind of culminates everything that they've learned up to that point.
So Module 4 is evaluation and scholarship, and I apologize. I see that we have the wrong competencies listed here. So I'm going to, oh, actually I have my notes are correct. So in terms of the evaluation piece, the learners are going to learn how to articulate the appropriate use of formative, summative, and high stakes evaluations when they're using simulation-based experiences. They're going to evaluate participants as directed by the objectives or the learning outcomes and the intent of the simulation. They will develop appropriate evaluation instruments for outcome measurement. They will be able to share clear, appropriate, constructive, and timely formative feedback during and after the simulation to support learning. And that is going to be driven by the level of the learner, both in terms of their clinical experience and their simulation experience. So how much support they need is going to be dependent on those factors. They're also going to be able to provide discrete, constructive, and timely summative feedback in a safe learning environment using standardized formats. In terms of scholarship, our aims for our educators would be that they would be able to appraise research and evidence in simulation practice for use in teaching and clinical simulations. The amount of literature on simulation-based learning is growing exponentially, and so it's really important to be able to critically appraise and decide whether the research is valuable to informing your practice as a nurse educator. The module also supports the mentorship of nurse educators in simulation practice and how important that is in terms of developing skill as a simulation nurse educator. The competency also indicates advancing simulation knowledge through participating in simulation projects or research activities. So any of you that have taken any of the modules know that I'm always pushing everyone to consider how they might develop a research project around any innovation and simulation that they're implementing. And then, of course, the importance of disseminating that information related to the implementation and innovations in their simulation to the health professional community through conferences and through publications. And we have Nicole Harder here, who is the editor for the journal Clinical Simulation in Nursing, where many of us like to publish our projects. So in terms of the content for Module 4, week 1, we talk a little bit about evaluation and scholarship. And week 2, we focus specifically on formative, summative, and high stakes assessment of learners. In week 3, we focus on simulation research and opportunities and funding and different things like that. Week 4, we focus on scholarship and dissemination. And we actually have our participants present either a poster or an oral presentation about some type of simulation innovation that they have done at their own clinical site. And then week 5, we talk about curriculum and program evaluation. And finally, week 6, we talk about faculty development. And back to Suzanne.
Yes, thank you, Marion. And I did just post the CASN competency guidelines there. Thank you. Please add questions to chat. So to just give you a little idea about the timeline, and this has actually changed a little bit now. Oh, no, it hasn't. We're right on target. We mentioned the 4 modules with 7 weeks each. When we started this 4 years ago, it was very different time frames. I think Nicole and I are feeling good because we have gotten it to a point where module 2 occurred in March and May, and we will actually be finishing module 3 with 2 or 3 weeks off in between at the end of July. Usually we did module 3 in September, and and that's when module 4 will be now. But the 7 weeks, they are synchronous and asynchronous. We first started offering this in 2018, so it has been 3 to 4 years that we've been doing it now, and we cap it at 40 participants. I have been amazed because most modules we have between 30 and 35, and we manage that very well. We also use a flipped classroom approach using both synchronous and asynchronous. I'm glad to see we've updated to Zoom technology. We were using Adobe, and we use a Moodle platform, which works really well. But the course management system has the weekly readings and assignments and the online discussion boards. We have very structured discussion rulings, and they are kind of marked and considered to be done in a scholarly manner. And then people take the final exam. On average, there are 4 synchronous classes. So it's a 2-hour period of time when we are meeting synchronously, and then the other 3 weeks are asynchronous, and that's different for every module. And passing on to Nicole again.
Great. Okay, this is my favorite part of the modules, is the opportunities for networking, both within the course and then with us as the facilitators for that. And so we find that we have a combination. Most people do come from academia, that we are teachers in different programs of nursing, but we do have practitioners as well, nurse educators who are from different hospital settings, and that we've had some people who are from the military. And the advantage of that is that we, as Suzanne said, we use discussion boards, we use breakout rooms, but that we try to have a combination of being able to work with people who are in similar settings as you, as well as mixing it up, so that way you learn from each other. But we really do take the time to try to have these discussions and to hear about what's happening in your area, part of the country, and really sort of taking those advantages for networking with each other and with us as the facilitators. Obviously, we can't do this now, but whenever we've had the opportunity to meet with you at CASN conferences or any conference, we've tried to have to get together a bit and to talk a little bit about that. I know I've been even asked to be on a student's thesis committee because of just opportunities to get to know each other. So this is what I would find is a great opportunity. There's also the career advancement. We've heard of other individuals who have taken the CASN courses and have applied for positions in simulation at different institutions and have been successful. So even though they might not necessarily have years of experience in simulation, just by having certification in simulation, they've been able to get employment that way. And we're always available, even after people have have finished the program. We are still in contact with them and sort of working with people, like, how did I find, where do I get this resource? Where do I get that resource? So we found that it's been very beneficial in the long term as well. So strategies for meeting learning outcomes. So every, excuse me, every module has its own outcomes, but obviously at the very end, we do have the exam. So the way that we're allowing you to meet these learning outcomes is we do a couple of things. We have, well, this is more than a couple, but we do have people do pre and post self-assessments. And that just provides you with an opportunity to sort of see your own growth as you go through this program. As Suzanne said, we have these online discussion boards that are more than just, yes, I agree, or ditto, or that kind of thing. We really meant to use these as an opportunity to share what you know and to share what you've read with your peers. And if anything, I absolutely love reading them because I'm always learning from students as well. Like Marian said, we allow you to work through the development of a scenario, whatever your area is. And so we work through that. We do a lot of peer evaluation. So with your peers in the discussion boards, you're providing feedback to them at all times. So that's, it's a really nice way to also practice some of the skills in providing feedback and debriefing with your peers throughout the simulation program. We have quite a few toolkits, resources that we have, excuse me, that we have you create and work through. And these are things, like I said, that people will take with them even after they're finished the program, and are always adding to that. I mean, even for myself, and these are everything from articles to YouTube clips to webinars like this that somebody has found somewhere along the way, find them very useful in going back and looking at, okay, so how do we do this? How do we do that? So definitely creating your own little toolkit. Now, each module has its own exam. And they tend to be, well, short compared to a national certification exam, but it's a way to sort of wrap up things from the program and just allow you to start to think about how would you ask or how would you answer questions on the exam. And then, as we said, we do have the national certification exam that's twice a year that provides you with the designation of the CCSNE when you successfully finish that exam.
So as an essential component following the development and implementation after such a comprehensive program, we felt that it was really important that we involve some sort of program evaluation. So we planned for this at the onset and embedded the study within each module. So the overall objective of our study was to evaluate the CCSNE program and each of its 4 distinct educational modules. Specifically, we wanted to describe nurse educators' perceptions of the teaching and learning strategies that we used, and each of the learners' perceived ability to meet the intended learning outcomes of the module. Methods involved online surveys, telephone interviews, and the measures, we used pre and post self-assessment rubrics to evaluate participants' competencies for each of the modules using indicators leveled by Benner's 5 stages of clinical competencies. You can see on this slide, this was our first cohort, and it was really important that we gathered this data to make sure that we made the modifications that needed to maximize the learner's experience. So our first cohort, most of the participants were between 40 and 60 years of age. Most were female with more than 10 years of experience in simulation. They oftentimes were sim coordinators, lab instructors, lecturers. We did in module 1 have 6 that were in other, and what we found were a lot of individuals were between positions. They were, an adjunct sessional instructor, and they wanted to really develop and have certification to make them, more employable in the simulation world. And according to NACSL standards of best practice, our simulation facilitators need to have that education piece. So it was a really important piece for us to have that. One thing that I'm really interested in seeing in the future, especially after the onset of the pandemic, that many of our clinical instructors are now being forced into the world of simulation. And they're actively engaged in either in-person sim or virtual simulation. So I think we as educators, it's really important for us to advocate for this program and encourage those who are novice to simulation to take this course to help to build their skills. Some of the things that we see, because Marion and I teach the first module, some people are worried. They're like, oh, well, I'm hearing about everybody's experience. Maybe I'm not ready for this course. This course is designed from anyone who's new to simulation to those who've been in simulation a long time. We always can learn. I think as Nicole has mentioned, and Marion and Suzanne, we learn every time from our group. And so I think that this is a great piece. And now we have a Canadian certification that's supported by CASN. So that was really important. And so the results of this first cohort, participants were very enthusiastic about the course. They thought the feedback was, they thought the course was well designed and supportive, and it was generally quite positive. But it was important for us to look at recommendations for improvement. And so one of the things was the better management of technology. So the course was first delivered in Adobe Connect, and we were really challenged. We couldn't see the participants. The host had to unmute and mute participants before they could speak. Then there was always a problem with their speakers not working, their mics not working, the video not working. It would delay things. And so based on that, we recommended CASN switch from Adobe Connect to Zoom. So in 2020, CASN switched over, which has really increased the class's interactivity and satisfaction. One of the things that we encourage is everybody has their camera on, that they, can raise their hand, we can talk. We really want a robust discussion. So Zoom really has supported that. Another thing is the learner, they wanted more feedback on a regular basis. So what we did for module 1 and the other modules too, we gave more regular feedback. So more marking, and they get the feedback to help to develop their simulation scenarios. And then we also had providing learners' assessment and competencies. They felt that that had improved related to the course learning outcomes and indicators. And the first cohort of participants to complete the CCSNE wrote the certification exam in 2019 in March, and all of them were successful, which was really exciting news for us.
So this is to give you an example of the self-assessment rubric data that was completed for each of the modules. And so the first competency for module 1 was draws on foundational theories and simulation pedagogy when teaching with simulation. There are 6 indicators that fall underneath that competency, and the participants were asked to rate themselves on a 5-point scale from novice to expert, and they were given descriptors for each of these ratings. So if you look at the first indicator, describes foundational theories and frameworks commonly embedded in simulation pedagogy, you'll see that before completing the module, all of the participants rated themselves from novice to competent, with most rating themselves as novice to advanced beginners. But after the module, all rated themselves from advanced beginners to proficient, with now most of them rating themselves as competent. And so that trend is evident across all of the indicators, which demonstrated that the course improved the nurse educator's self-perceived competence related to all of these indicators. We also received qualitative feedback from participants, and these are just a few of the quotes that highlight the impact of the program. One person said, very probably one of the best learning forms, excellent participation, really supportive environment, everyone was contributing, everyone gave excellent feedback in a constructive way. And this is how we were able to learn from each other, and even Jane and I, we were finding we were learning from our participants as well. Another participant said, I've already taken information from this course. I'm more cognizant of the student role and making them feel comfortable. Strategies to support them, helping them feel prepared ahead of time. I'm considering that more than I had prior to doing this course. And the third participant, I enjoyed it so much because it is so relevant to what I do on a daily basis as a nurse educator. It certainly has served as an inspiration to learn more and strive for excellence in nursing education and simulation. You have also inspired scholarship ideas, and so that makes us very happy to hear that. So in the 3 years that the program has been offered, 170 people have registered for at least one module. There were 7 that have completed all the modules but have not taken or passed the certification exam. But we do have 60 certified Canadian simulation nurse educators across the country now. So that's an average of 20 per year. And so that's great, and that's growing. So we encourage you to, if you haven't done so, to consider taking the course and writing the certification exam.
So trying to sum up for you in a timely fashion here, we definitely have demonstrated the feasibility of delivering this type of program with its asynchronous and synchronous variety of learning activities. I think for me as well, the networking with my colleagues in this area and getting to know people across Canada with similar interests. The results of the evaluation definitely informed some of the modification that we've made, and we are always tweaking them. The modules are never the same, adding to references and updating to match what's going on in the world around us. And I really feel like this is contributing to a development and capacity building of a whole new cadre of nurse educators across Canada who have the knowledge and skills they need to design, facilitate, and evaluate these clinical simulation programs in nursing and in interprofessional simulation. Some of the future implications are the continuing networking, and we've listed a few of the organizations there. I see colleagues in the room here. Collaboration on research scholarship of teaching and learning, so graduate student mentoring, and having our students in these modules, learners in the modules, to be empowered to disseminate and print what they're doing, giving advice around that as well. We're definitely developing more simulation-based centers. The career advancement that Marion talked about, I think the certification definitely pulls some weight, and looking into some clinical mentorship opportunities as well. We're hoping for this paradigm shift for nursing education.
So we would like to open it up now for any questions that anyone may have.
You can raise your hand or you can write something in the chat.
One thing I was just going to add, it's not obviously not a question, but I know that there are people who might have quite a bit of simulation experience as well. The certification exam, the actual national exam, of course, it's recommended that you take the 4 modules before that. However, people can challenge the exam if you can demonstrate a background and experience. So I just want to put that out there for people who maybe do have extensive experience and a background in simulation, that it's not necessarily that you have to start, you don't have to take it. It's, of course, we'd love to have you, but having said that, it's not necessary.
You can also even pick and choose the scenarios that, or so the modules that you want. If you feel that, you know, you may be comfortable in design, but you really haven't done anything in IPE, that's you know, an option that you can move into those. And again, they're not structured that you have to start in January with module 1. You can pick and choose. We would strongly recommend you take 1 before 4, because 1 is about designing the scenario and 4 is about evaluating it. But we have had a number of students that have started with 4 and they've just brought in a scenario that they've created already, or we provide them a scenario and it goes through that peer review process.
Well, I would like to jump in and answer or speak to the first question in our chat board there from Anna, who was a previous student and actually is in British Columbia and came up with some very innovative ways of clinical internships. But it definitely is something that I think we as a group and with CASN and CAN-SIM's help might be able to look into a little bit more for people who really want to get into this method of teaching, but presently don't have that opportunity with whatever position they're in right now. I don't know about the elective component of it, but I'd be curious to see what my other colleagues have to say about that.
That's probably a larger CASN question. But having said that, I know that the 2 questions here, students have, or participants have asked for some kind of mentorship or internship program, because some people, especially if they're new, they maybe just need a little bit more support as they go along, depending whatever it is that your interest is in. So if you're more interested in the academic scholarship, maybe that's where you need it. If it's more in the design in hospital-based simulations, you know, that kind of thing. So that's definitely something that I think we've talked about, but in terms of having it happen, that's a broader conversation with CASN administration. And also with a refresher, I mean, the program is still new enough that we don't have one. Having said that, I think that there would be, I think that's a great idea for people who maybe have experience, but just want to have some sort of pre-exam refresher or, a condensed module or something like that. I think these are great ideas that we definitely could have broader discussions about.
And I should say that as far as the mentorship goes, CANSIM, who's hosting this now, we do have a research committee. We do have mentorship to support you in implementing both in-person simulation and virtual simulation. So we do have a network of over 1,500 members from around the world, a large majority of those in Canada, that also can support you for that mentorship piece. But it's also something that we should definitely talk to CASN about to see if they would be interested in further developing that also.
I think too, in relationship to refresher courses and other things, that it's important to acknowledge there are a lot of different opportunities out there. George Washington University posted a 7-module MOOC that I took and learned something and enjoyed. And so, what I love about this program is that it's nationally based, and we're getting to meet and know people on the ground in Canada, and can have an effect through CASN of actually molding the policies and procedures across Canada for our nursing educators and nursing education. And that's really exciting to me.
And I believe in our last module 1, we had a couple of individuals that were taking the program that were outside of Canada as an interest. So that, is also showing that leadership of CASN reaching out to a larger population beyond our borders. Any other questions?
Well, and I would love to say, for those who have taken one of the modules, if you had anything you wanted to share with the group. Sometimes words from experience are much more valued. And I'd also like to know what people see as barriers or challenges to them signing up for the modules. If it's financial, if administration might back you or not, or if it's time, like I would suspect for many of us, or some fear, about being ready or not being ready.
Time is definitely a barrier. And I would just like to say that as instructors, we're very aware that you're juggling a lot, especially now with the pandemic, and that we're very flexible in terms of assignments. We just like to keep you moving. But once you get your assignments done, then you can complete the course. So consider that.
And Mark, in response to your question, most of our learners and participants are working full-time. That's my sense. And so the flexibility adds to that. We know we're on very different time frames from coast to coast. When we offer the synchronous component, we videotape every synchronous class. So if life happens and you miss one, you have it, and we record the chat to it as well. I don't know, I'm kind of reaching out to participants in it. To me, 6 to 10 hours a week maybe would be reasonable for readings, and 2-hour commitment to the class time, and the costs we can answer. That's $500 a module, right?
It is considered to be a graduate level course, and I believe we were told that it should be at least 3 hours a week of time outside of the class.
So 5 hours to however long. And again, that depends on where you're at in the learning curve, what background and experience you have. If the literature is all new to you and you are just learning and diving in, it may be a little bit more of an investment.
Yeah, I'm just actually on the CASN website, and the registration fee, I believe, is $325, if I'm not mistaken.
Per module?
Member of the school, if you're a member school employee, registration is $275 per module. This might be even something that if you do a grant, you could possibly incorporate that into a grant if you wanted to do some simulation evaluation. And so you can put that in. Many universities, some colleges also have grants that you can, internal grants. And so you may be able to absorb some of that cost within that.
Or professional development funding.
So I'm seeing quite a few other very specific questions, as well as ones that are testimonies toward the value of the program and why, even either as a novice or someone who thought they knew a lot about it, they learned something. And I think all four of us have said we're constantly learning with all of you. I'm also conscious of time here, knowing we're almost at the top of the hour. There was a specific question about sample exams, and I don't believe they exist. That is where Sharon, Sue was asking. It might be, that's why people take the modules, because there's a final exam for every module, and then you get an idea of what the certification exam questions might be like. So that is a pro. I don't know what the cost of just the exam is. I'm sorry, did you say that already? 275 or that was?
No, I'm not sure how much the exam is. So my apologies on that. I don't know. But there's right on the website, Leah Watts.
Leah Watts will be able to tell you.
And what I'll do is I'll put Leah Watts' email and her name in the chat. And if you would like to learn more about those specific pieces, you can just send her off a message.
And I'm also thinking, you have all of our emails here too. Please don't hesitate. I see quite a few BC folks, and some I've talked to and some I haven't, but would love to connect as well with any of you. Thank you all for coming, and we're excited. The taping of this will be up as well, right?
It'll be on the CANSIM website under the webinar tab. So
We'll tweet it.
On behalf of CANSIM, we'd like to thank Suzanne and Nicole for joining us on this important webinar, and thank all of you for your time and attention. We are welcoming you to join CANSIM or to look at any of our webinars or the resources that we have. So thank you again and have a wonderful day.
Thank you.